My name is Glenn Yu. I'm a professor of ophthalmology at the University of California in Davis. Yesterday at AAO Retina Subspecialty Day, I gave a talk on the performance of suprachoroidal triamcinolone acetonide in the real world. It's the idea of a microneedle, a suprachoroidal microneedle, is that it's a very short needle that's just long enough to penetrate the sclera without perforating into the vitreous cavity. And the advantage of that is that you can deliver drugs that's more sequestered posteriorly to have optimal effect on the retina. So based on the phase 3 Peachtree study, suprachoroidal triamcinolone has been approved for the treatment of uveitic macular edema. And so the talk I gave was actually to talk about how the performance is in the real world. So what we found was that using the IRIS registry and data from there, we found that actually in the real world settings, people who received a suprachoroidal injection of triamcinolone acetonide actually were able to wait 88% of these patients were able to go injection-free without the need for a repeat or rescue triamcinolone injection for out to 12 months. And that's really good considering that many other treatments are only like 3 to 4 month drugs. In addition, I talked about techniques on how to optimize this injection process, that you should make sure you hold the microneedle very perpendicular, maintaining firm pressure on the eyeball, and then also injecting very, very slowly. Finally, I ended the talk by describing some of the upcoming platforms for this injection using things like axitinib as well as other potential treatments using this suprachoroidal microneedles. Using IRIS database, registry database, that performance in the real world using suprachoroidal triamcinolone acetonide actually compares favorably with those in the Peachtree phase 3 trial. It's interesting because in the phase 3 Peachtree trial, every patient received a second injection after 3 months from their first injection, whereas in the real world, we find that majority of patients actually, if once you do one single injection, they can go at least past 6 months without the need for a repeat injection. So I think that actually shows favorably in real world settings that actually the durability of this suprachoroidal triamcinolone is quite good.